Ventricular septal defect, VSD, is a heart condition characterized by a hole in the septum, which is a wall of muscle that separates the heart's two lower chambers, known as the ventricles. Your heart is a complex organ divided into four chambers: two upper chambers called atria, and two lower chambers called ventricles. The right side of the heart pumps deoxygenated blood to the lungs, while the left side pumps oxygenated blood to the rest of the body. Between these two sides is a wall of muscle called the septum, which separates the left and right chambers. In a healthy heart, the septum is a solid wall with no openings, ensuring that oxygenated and deoxygenated blood don't mix. However, in individuals with a ventricular septal defect, there is a hole in the part of the septum that separates the two lower chambers, or ventricles. This opening allows blood to flow between the left and right ventricles, which can lead to various complications if left untreated. The size and location of the defect can vary significantly from person to person. Some defects are tiny, barely noticeable, and may close on their own as the child grows. Others can be large, causing significant health issues and requiring medical intervention. VSD is one of the most common congenital heart defects. The word congenital here means that the condition is present at birth. It affects approximately 1 in every 500 live births, making it a relatively frequent condition in newborns. It is slightly more common in premature infants compared to full-term babies, and it can occur on its own or with other heart defects. Causes of ventricular septal defect. The causes of VSD are primarily related to abnormalities in the development of the heart during the early stages of fetal growth. The heart begins to form soon after conception, and by the 8th week of pregnancy, it is fully developed. During this period, the heart develops from a simple tube into a complex organ with four chambers and a septum dividing the ventricles. If something interferes with this process, a VSD can result. The exact cause of these developmental abnormalities is often unknown, but both genetic and environmental factors are believed to play a role. Genetic factors seem to play a significant role in the development of VSDs. Some children inherit genetic mutations that increase their risk of developing this heart defect. So, families with a history of congenital heart defects may be at higher risk of having a child with a VSD. Environmental factors during pregnancy can also contribute to the development of VSDs. These include maternal infections, exposure to certain medications or chemicals, alcohol consumption during pregnancy, and poorly controlled maternal diabetes. However, in many cases, the exact cause remains unknown, and VSDs can occur even when parents have no known risk factors. Symptoms of ventricular septal defect. The symptoms of a ventricular septal defect can vary widely depending on the size and location of the defect. Small VSDs may not cause any noticeable symptoms and might be discovered accidentally during routine medical checkups. However, larger defects can lead to more severe symptoms that become apparent soon after birth or during infancy. One of the most common symptoms of a significant VSD is a heart murmur. This is an abnormal sound heard through a stethoscope, caused by the turbulent blood flow through the defect. Parents and caregivers typically can't hear this murmur without medical equipment, but it's often the first sign that leads to further investigation and diagnosis. Babies with larger VSDs may experience difficulty feeding and poor weight gain. This occurs because the heart has to work harder to pump blood, which burns more calories. As a result, these infants may tire easily during feeding, take longer to finish their meals, or sweat excessively while eating. Shortness of breath is another common symptom, especially in infants with larger defects. Parents might notice rapid, heavy breathing, particularly during physical activity or feeding. In severe cases, babies may develop a bluish tint to their skin, lips, or fingernails, also called cyanosis, due to poor oxygenation of the blood. As children with VSDs grow, they might experience decreased exercise tolerance. They may tire more quickly than their peers during physical activities or have difficulty keeping up during play. Some children may also experience recurrent respiratory infections due to the increased blood flow to the lungs. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of ventricular septal defect. Diagnosis of a ventricular septal defect typically begins with a thorough physical examination. If a doctor suspects a VSD based on symptoms or the presence of a heart murmur, they will likely order several tests to confirm the diagnosis and assess the severity of the defect. An echocardiogram is usually the primary diagnostic tool for VSDs. This non-invasive test uses sound waves to create detailed images of the heart's structure and function. It can show the size and location of the defect, as well as how it's affecting blood flow within the heart. For many patients and families, seeing the defect on the echocardiogram screen can be a pivotal moment, providing a visual understanding of the condition. In some cases, additional imaging tests may be necessary. These might include chest X-rays to evaluate the size of the heart and lungs, or cardiac MRI for more detailed images. Electrocardiograms may also be used to assess the heart's electrical activity and detect any abnormal rhythms. For complex cases or when planning surgical intervention, cardiac catheterization might be performed. This involves inserting a thin tube, called catheter, into a blood vessel and guiding it to the heart. While more invasive than other diagnostic methods, it provides detailed information about blood pressure in different parts of the heart and can help guide treatment decisions. Treatment for ventricular septal defect. The treatment approach for ventricular septal defects depends on several factors, including the size and location of the defect, the age of the patient, and the presence of any complications. It's important to note that not all VSDs require treatment. Small defects often close on their own during infancy or early childhood, requiring only careful monitoring by a pediatric cardiologist. For larger defects or those causing significant symptoms, treatment is often necessary. The first list of treatment usually involves medications to help manage symptoms and prevent complications. Diuretics might be prescribed to reduce fluid buildup in the lungs, while ACE inhibitors can help lower blood pressure and reduce the workload on the heart. In infants with feeding difficulties, special high-calorie formulas or feeding techniques may be recommended to ensure adequate nutrition and weight gain. This nutritional support is crucial for the child's overall development and can help strengthen them for potential future interventions. For VSDs that don't close on their own and continue to cause problems, surgical repair is usually recommended. The timing of surgery depends on the individual case, but it's often performed within the first year of life for large defects causing significant symptoms. The most common surgical approach involves open heart surgery. During this procedure, the surgeon makes an incision in the chest to access the heart. They then use a patch, made from the patient's own tissue or synthetic material, to close the hole in the septum. While the idea of open heart surgery on an infant can be frightening for parents, it's important to know that pediatric cardiac surgeons are highly skilled and experienced in these procedures. In recent years, less invasive techniques have been developed for closing certain types of VSDs. These catheter-based procedures involve inserting a closure device through a catheter, which is then guided to the heart to seal the defect. While not suitable for all types of VSDs, these techniques can offer a less invasive alternative for some patients. Recovery after VSD repair varies depending on the size of the defect and the type of procedure performed. Most children who undergo surgical repair spend several days in the hospital for monitoring and initial recovery. The full recovery process can take several weeks, during which time the child's activities may be restricted. At the end, long-term outcomes for children with repaired VSDs are generally excellent. Most go on to lead normal, healthy lives with no restrictions on physical activity. However, lifelong follow-up with a cardiologist is typically recommended to monitor for any potential late complications. Now, we want to hear from you. Have you or a loved one ever been diagnosed with a heart condition like ventricular septal defect? What advice would you give to others going through a similar experience? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.